Well, good morning, everybody. Thank you for joining us. For those of you that don't know me, I'm Scott Moffitt, President and CEO of Summit Financial Group. Appreciate you taking some time with us this morning to talk about a topic that I think for a lot of you is certainly top of mind. I know I've had a number of conversations with many of you about Medicare, so I think it's great that we've got an opportunity to actually have Tammy Barnett, who is a Medicare specialist, a licensed specialist, to join us this morning. Tammy, welcome, and thank you very much for being here. And just another quick by way of introduction, we also have Brittany Rogerson, who is a recent addition to our Summit team. She is actually our Business Development Director. And while she is not on screen, she is acting as our co-pilot for this. So putting up the slides and going back and forth between Tammy, myself, and everything behind the scenes, Brittany is in charge of all that. So Brittany, welcome and thank you for joining us this morning.
Good morning. Thank you.
Tammy, what I'd like to do, if it's okay, I've got a handful of questions that I'd like to just kind of chat with you about, because I think there are some questions just people have about, they know that they have to apply for Medicare, or they know that there are some things with Medicare that they need to do, but they're not really sure who to talk to. And so, what does somebody, like yourself, what services do you provide for seniors and for people that are looking at Medicare?
So I am a state licensed insurance broker, health insurance broker, which allows me to help people sign up for Social Security. We help them with Medicaid. There are certain situations with chronic diseases that you're not insurable, so Medicaid comes into effect. And then I also help them sign up for their Medicare A and B. And then I go into all of the plans that the insurance carriers offer that supplement Medicare, but it is still paid through Medicare.
So Tammy, when you talk about you go into all the different plans, because it's my understanding, and I know just enough about Medicare to be dangerous, right?
Right.
But I know that there are a lot of different companies that offer plans, and I know it just seems like certain plans are better for certain people than others. I guess multiple answers to this question here, but are you able to work with multiple plans, and what would make one plan better or worse for somebody than another plan?
Okay, so I do currently work with 8 different carriers. So the carriers are like United Healthcare, Cigna, Aetna, Anthem, Humana, WellCare, MedMutual. So they are the carriers, and they each within that carrier have several plans. They could have a supplement plan, they could have a Medicare Advantage plan, and they can have a prescription drug plan. And then they have what is also called like a veterans plan. So those plans are broken down by the client's needs. So it's not that I would say, oh, this particular carrier's plan is the best plan. It can't work like that. I have to have information, doctors, prescriptions, pharmacies, hospital preferences. I have to know what their health looks like so that I can match it up to a plan within the carrier. And I usually try to match like 3 plans and give options because it's broken down by their needs. That's how, in this business, we're not allowed to say good, better, or best. So I'm going to say I give them 3 favorite options.
Gotcha. And you just touch on something, and like I said, I know just a little bit about this, but I think it's an important point to emphasize. You said, we're not allowed to say good, better, and best because you're working with seniors, right? And because this is your state license, you're very regulated. The process is very regulated by which how you represent a person and how you go about this process. Is that correct?
Correct. I have to take a state board test to get my license. And then every year with each carrier, I have to get certified to be able to sell their products. And then I also have to take what's called the AHIP, which basically says, yes, I understand that all medical information is sensitive. and it can be trusted. I have many guidelines that I have to work with under the Center of Medicare and Medicaid Services. I'm
Okay.
not allowed to door knock. I cannot cold call. I cannot, Scott, if you were to say, hey, call Tammy, she's a Medicare broker, and they say, oh, just have her call me. I cannot do that. I have to be initiated with a call or some form of contact first. And then
Okay.
I also have to do continuing educational credits.
Got it. Okay, great. I think that's helpful to know. All right, let's turn a little bit more to the specifics of Medicare, right? I
Okay.
know, and Brittany, I think we've got a slide on this, but there are certain times of the year, open enrollment, initial enrollment, things of that nature. Brittany, if you want to put that slide up, and Tammy, would you mind just kind of walking us through those critical times of the year?
Right. Okay, so you have your initial enrollment period. So I'm going to briefly kind of talk about this. As you have worked 40 quarters in your life, which basically comes out to 10 years, you've paid into your Part A premium. So you will have a 0 premium when you file, and then you pay your Part B. This is at 65. That is your initial enrollment period when you choose to sign A and B, unless you are on disability. If you are on disability for 2 years, Medicare will automatically roll you over into Medicare A and B. So that's your initial enrollment. Some people prolong their A and B because they want to work a little longer. So you're still in your initial enrollment period.
Tammy, if they're still working, is it my understanding, is it correct that they still have to apply, but they don't actually have to take Medicare? Or what is that? What's the requirement?
They can delay it. Medicare A, there's no harm in taking it at 65 because it costs you nothing.
Okay.
All right. But you can delay your B. It happens all the time.
And
When
is there
you
anything that has to be done in order to do that, or is that an automatic thing?
you just don't, you have to physically sign up for your B.
Okay, got it.
So
Good.
A can be automatic, but your B you have to sign up for. And just know if you choose to delay it, which a lot of people do, you definitely want to make sure that you have a certificate of credible coverage from your employer, because they will request it when you do sign up for your B and you're ready to move forward.
Okay, good point.
And then the next enrollment after you have received your red, white, and blue card is your annual enrollment, and that's October 15th through December 7th. You will see tons of commercials, lots of mail goes out at that time. That is giving you the opportunity to examine what you have and see if you want to make any changes. So it's kind of like, I'm not happy with this plan, I need a new plan, and you can change and it will be effective January 1st. So this is your free shot. And then open enrollment is January 1st to March 31st. What happens here is it was designed for people who changed their plan for for annual enrollment, and then they decided they didn't like it or they wanted to go back. So
So that's like so that's like we do this in the fall through
Mhm.
annual enrollment, we make changes, and then that first quarter of the next year, we have an opportunity to change back. Is that what you're saying? I mean, basically, it's to undo what we did.
Correct. Or if you missed annual enrollment, then you have a backup plan. It's not advertised. Open enrollment really isn't advertised. And it's really not something that as agents and brokers were allowed to advertise as well.
Okay.
So it is your backup plan.
So essentially, and let me make sure I understand this.
Mhm.
Let's say we miss annual enrollment, right? So
Mhm.
not only do we make a change, we just miss annual enrollment. It slips our mind, whatever.
Mhm.
Or maybe we become aware in January, hey, there might be a better plan for my situation. Do I have the opportunity then, even if I didn't make any changes in January, to go ahead and make those changes?
You do. You do.
Okay, that's cool.
Yeah. So it's I always say it's your backup because annual enrollment is tough. It's tough to get everyone in, and it's a lot of information because, as you know, the plans change.
Right, right.
So some people are still looking through their plan to see if, that's if they're not using a broker or a captive agent, they're looking at their plans trying to just discern it, and then they miss the annual enrollment cutoff time.
And Tammy, on that note,
Mhm.
as you said, plans change, right? Situations change, people's medical situations change. Do you recommend that every year people with the plans review their plan or shop their plan, if you will?
Absolutely. This is something that I think gets a lot of people in trouble with their Medicare insurance and with their plans. Those plans come out to us agents and brokers in August and September. We are allowed to discuss them as of October 1st. Okay.
Okay.
So there's going to be huge changes this year because of the Affordable Care Act. They passed within that bill that said, hey, we're going to put a $2,000 cap on prescription drug plans. And that's that. They're going to do away with the donut hole, so to speak, right?
Yeah.
So the plans across the board are going to change drastically this year.
Okay.
So I would recommend that every year, because if your medications, doctors, networks, they all change. And
Perfect.
then if we could just touch briefly on special enrollment real quick.
Sure.
Special enrollment is when you have special circumstances, and a lot of people don't realize that your Medicare Advantage plan is based on the county you live in. So if you move, you definitely have about 6 weeks to change your plan. Or if you're a snowbird, a lot of people go to Arizona, Florida, you know,
Sure.
want to, so there are special enrollment periods that allow you to change your plan. So it's kind of the golden ticket, just in case you have,
Yeah.
so you do have some options there.
And Tammy, I mean, I know we want to keep this brief, but you just
Yep.
brought something up that I have another question with, because I have a number of clients that are in this situation. They may have a second home in Florida, or any place where we actually have blue skies and sun,
Right.
in January and February, unlike here in Cincinnati. How is your residence determined for Medicare?
It's where you filed and where your permanent residence is.
Okay, so just basically
Probably like
wherever your tax
that.
return, same thing.
Right. It's where your
Okay,
tax return is.
cool. All right. Now, for supplemental insurance, do
Mhm.
we have the same calendar or is that different?
Supplement's different because Medicare, you can sign up 3 months before your birth date on initial enrollment period and 3 months after.
Okay,
Supplement, you have like 7 months total, but
okay,
you also definitely want to do that because you are guaranteed issue at 65. After 65, you go through underwriting, where Medicare Advantage plans, you don't.
okay. I think say that again. I think that's really important. So for the supplemental plan,
Mhm.
you if you run the risk of not being able to take advantage of it based on your health predisposition or whatever has happened after 65.
Correct.
Okay,
And you have to have a prescription drug plan with that supplement plan.
interesting. Okay.
You
So
know,
what's that window? Is it at 65, it's 7 months either side of our birthday? Is that what it is, or how does that work?
we can sign up earlier. I typically don't do it any earlier than 3 months, and I'll tell you why. Because as a broker, it's my responsibility to keep checking on that application to make sure, because what they do ultimately with the carrier is they put it on hold. And then I have to go back through and I'm constantly checking, hey, we're getting close to the date, make it active, make it active, make it active.
Got it. Okay. Yeah, that's a really good point. Now I know and Brittany, I think we may be skipping over a slide here. I know you got to it. I apologize, but I want to talk about the Medicare costs and premiums as it relates to income. And we've had a few clients that have fallen victim of the increased percentages because their income has gone up, right?
Correct.
And I think, Brittany, I think we've got a slide on this. that kind of breaks that out. But Tim, if you can talk a little bit about how, how these premiums determined and just how that works, that would be great.
Okay, so if you fall under, it's how you file your taxes. That's real important because some people file their taxes as individuals. They're married, but they file them as individuals. That's key because some people together, their combined income goes over $103,000 a year. So you're going to pay a higher premium for your Part B. Everyone pays Part B. No one's getting out of it, okay? So if you were under that 103 as an individual or as joint, 206,000. If you are under that, you're only going to pay the regular premium of $174.70. There is no D penalty or IRMA premium, I should say, that you will pay. Once you go above those two brackets, you're going to pay a higher Part B premium of $244.60 or even higher, and then your prescription drug plan premium will tack on $12.90 up. But keep in mind, if you are on a Medicare Advantage plan, you are only paying the I want to say this right because it does get a little confusing. You will pay still the Part D premium. You will still pay it because it gets a little confusing because in a Medicare Advantage plan, they have the prescription rolled in.
Okay.
But you still have to, and it's all tied under that one premium. And I'm just going to use this as an example of maybe $27. Okay.
Yeah.
You're still going to pay that IRMA Part D premium.
Okay. Okay. So let me just use this chart and make sure that I'm following along here because you're right, it gets a little complicated. But if I'm an individual, if I'm filing individually, right? And
Yep.
I'm at $128,000. So I fall into that 103 to 129 bracket.
Uh-huh.
My Part B is going to be 244.60 plus an addition to the Part D, $12.90.
Correct.
Right. But
And
if
that's the prescription.
yeah, but then if I go from 128 to 130, right? So a $2,000 increase in my income,
Your
my
premium.
premium for the Part B goes up $105 a month, and the Part D edition goes up at $33 a month. Is that right?
Correct.
Yeah, and that's per person, obviously.
Correct. And a lot of people get that Part D confused because if you remember, Medicare says you have to have a prescription drug plan. Even if you don't take an Advantage or a supplement plan, right? You
Yeah.
have to have that Part D or you're going to get penalized every month that you don't have it. So a lot of people associate that Part D IRMA with just the drug prescription plan. It's across the board.
Wow. Okay. So let's say, in a year we have, higher income than maybe the following year. Will the premium go back down and how does that work?
So if let's say that you're at the $104,000 mark, right? And you're paying IRMA, right?
Yep.
But the following year it goes up. If you're saying it goes up again, then yes, you're going to pay a higher IRMA and it's automatic if you have it taken out of your Social Security.
Okay.
If not, they're going to bill it. But if it goes down, if your income goes down below that 103, then you're going to pay less. But you
Okay.
have to make it a point to stay on top of that. That's as insurance brokers, that's one of the services we help with. Like we get involved with that kind of stuff.
And it looks like if I'm correct in reading the chart here, that our 24 premiums are going to be based on our 22 income. Is that correct?
Correct.
Okay. All right. All right. That's good to know. Okay. So listen, let me ask you this. So, we've got people listening, we've got clients that are, based on what we've talked about here, feel the need to have a review, right? They want to kind of go through things. Just briefly walk me through what's that process like? What do they need to provide you? Just kind of walk me through the time involved, things of that nature.
Okay, so I kind of simplify it for people. If they want to do it via email, I will send them what's called an intake form. That intake form has all their information that I need. It has their doctors. It's requesting a list of doctors, your prescriptions. Prescriptions are very important that you put the right dosage down, if it's a tablet or a capsule or an injection, and how often you take it in one day. Because what I do is I take those doctors, I take that prescription, all the medicines, and I'm going to analyze it. I'm going to put it into a system and I'm going to analyze to see who's giving those needs, who's meeting those needs, right? Their favorite. Okay. I do that on the backside, and then I call once I have the options that I feel would be their favorites. And then I sit down with them and I go over it step by step. So when you meet with me, I tell everyone allow an hour to 2 hours, because I don't know what questions you're going to have. And I want to be sure that when I leave, you have every information that I could possibly give you to make the right decision and choice for yourself. And two, I will say, if I don't know the answer, I have uplines and I will call. I will get the answer. I'm not afraid to say, this industry is so big, I can't know it all. It's
But it's changing
impossible.
all the time, right? I
Right.
mean, there's constantly, updates and things of that nature. So,
Correct.
yeah.
So I usually try to get those answers the same day while I'm there.
Okay.
But definitely I will sit down with you and I will give you all the plans, the three plans that I think fit your needs. I'll sit down, I will explain them all to you. And then really it's just about you making the best decision for yourself. I will say that supplement plans are different in the sense of this. Every supplement plan offers the same coverage. The only difference is the premiums.
No
So
kidding.
correct. So I do supplement plans and I do indemnity plans and things like that. So I kind of give all the options. If a supplement plan is something that somebody needs, then I'm going to look and research their prescriptions to get their prescription drug plan. And that can be between two different carriers. They don't have to match.
And Tammy, I'm guessing, I mean, because as much as you do this, I'm guessing you've got experiences or situations where you're saving people hundreds of dollars a month based on picking the right plan.
Absolutely. Because I'm gonna ask a sensitive question with them. I'm gonna say, where are you at financially? Because
Yeah.
there are some people that a supplement plan, you're going to pay more on the front end, but you're not going to have those copays. People who are really sick fit really well into supplement plans because they can budget. They know what they're going to pay every month. A Medicare Advantage plan, they have a lower premium, but they're going to have copays, but they're going to cap out at a maximum out of pocket expense at some point in the year, but less than 1% do. So there are things that you have to consider. And right now with all the costs of everything and knowing their financial needs, because there's ancillary products in those advantage plans. Some people need transportation. Some people, they need vision benefits. So I take all that
Yeah.
into account.
That's great. And just to be clear, your compensation, the clients aren't paying you anything. Your
Correct.
compensation is state mandated from the insurance companies, correct?
Correct. And all the carriers have to pay the same amount.
Yeah.
So
So there's no, you're truly on the side of our clients and determining what is the best plan overall for them.
correct. I
Tammy,
don't want to, I do a concierge. I don't ever want to put somebody on a plan that doesn't fit their needs.
it doesn't make any sense for anybody, right? It
Right.
just there's no winners there. You're willing to come out and meet the clients in their homes, is that correct?
Yes. So I work out of my home. I have conference rooms that I can go to. Some people are not comfortable with me coming to their home and they want to meet in a public place. That's fine.
Are you okay to meet? You would meet with our clients here in our office as well?
Yes, I can meet wherever. I
Okay,
am licensed in Kentucky, Indiana, and Ohio.
great. And we have clients in all those states, so that's good to know. I think we have contact information. Is it just start with a phone call or an email to you, Tammy, for those
Correct. I
interested?
have to be contacted first, and then at that point I can send out information. And briefly, I have to send out what's called a scope of appointment. Legally, I have to do that, and that gives me permission to talk to them. So usually I fill it out and all I have to do is sign it.
That's great. I know we're running out of time here. Time goes by really quickly, and it's such a broad,
Yes.
massive topic, right? It's hard to get everything in a real short period of time. But if you've got, Tammy, if you've got just a couple more minutes, I'd like to just ask if there are any questions right now that people may have, if you're okay with that.
Yeah.
Yeah, so Brittany, if you want to give that opportunity, if you've got a question, just go ahead and put it in the chat, and we will get that to Tammy here.
So chat is on.
All right, the chat is on. I don't know exactly what that means, but I'm assuming that would mean that we'll see if there are any questions that do come up here.
I just see me and you. That's what I
Yeah.
see. Okay.
I'm not sure if I'm seeing them or not. Brittany, is there anything on your end? Are you seeing anybody with
I
questions?
think there's no chat in the box right now. Do you have any general questions that you get pretty often?
I do. A lot of people ask about vision, they ask about hearing, and they ask about dental benefits. So you need to know that that's going to be on the Advantage plans. It's not going to be on the supplement plan. They only offer discounts. I also get asked about what is an indemnity plan. That is something that can be added to. That helps you with your copays on an Advantage plan or a supplement plan if you have certain, which copays do rarely happen with a supplement, rarely. Cancer policies, long-term care. Because if someone that you love has to be admitted into an institution, you need to talk to a broker or an agent, because that's a whole nother ball game, because Medicare Advantage was never meant for that. So there's other options. We talk about spin downs, we talk about, power of attorneys, we talk about trust versus just having someone on their financial.
Yeah, there's a lot involved with it for sure.
Yeah, that's typically where we get a financial advisor involved.
Yes. I
we did
thought
have
I saw
one
a
chat
question.
come in. Yeah, we do. So somebody said, if I have supplemental coverage for my employer in addition to Medicare, are you able to help with that?
Yes. So, okay. So if you are still working and you have coverage, it's actually, is it like an HMO? I'm assuming it's like an HMO or a PPO insurance, right? If that's the case, you're going to find out that your premiums on a Medicare Advantage plan are going to be way, way less, but it doesn't help anyone that's outside of you because they are individual plans. So at that point, if you have family members that are under 65, then we would have to go and look at under 65 insurance.
Tammy, he said, yes, it's a PPO.
It's a PPO. Okay, so yes, there are PPOs. Is it just for him or is it a family?
Well, we'll get that answer here momentarily.
I want to make sure I give the right answer for you.
Covers he and his wife.
Okay, so his wife would have to go on a separate plan and he could go on an Advantage plan. At that point, it comes down to the finances, what you're paying for insurance versus what ACA would be. ACA is the Affordable Care Act. So that would be your private insurance for your wife.
Great. Okay. Very good. And I think we had a question I saw pop up because you had mentioned wills and trusts. Tammy, you do not draft legal documents, correct?
No. I have been in this business for about 4 years. I have 2 parents that are elderly that I take care of. So I have learned to navigate with financial and lawyers because you need those. There comes a point in time when you need to be protected.
Absolutely. And for those that are looking for wills and trusts, yeah, as you know, I don't draft documents as well. However, we as well have contacts with attorneys capable of doing that, and also elder law attorneys with those types of situations. So that's great. I see that we're right at 11 o'clock. That puts us at 30 minutes. Tammy, I can't thank you enough. This was great. I really do appreciate your time. I think it's been extremely helpful. I'd love to be able to do it again, if you're open for it. And
Absolutely.
good, good. Thank you. And if you want to reach out to Tammy, obviously you can reach out to our office and we can put you in contact with her as well. But I think Brittany, you've got her contact information as well as ours. Is that right?
Yep, yeah, I can share that again, put that back on the screen, and then we can send this out if you're interested. And we'll also be sending out, if you're on our email list, the recording of this video and all of Tammy's contact information.
Perfect, perfect. That is great. So can you pop that up there for just one more minute so they can grab a phone number and email address? And again, Tammy, thank you very much. Appreciate it. Hopefully you'll be getting some phone calls from some people that really could use your guidance and advice. Brittany, as always, I appreciate you kind of being our co-pilot here, making us look like we know what we're doing from a technology standpoint. And for the rest of you, something that we are doing this year is we are doing a monthly webinar series just like this. It will be this same day. It's the third, I believe this is the third Thursday of the month. Next month, we're going to be talking with an elder law attorney about all of the issues and concerns that people have as we reach, you know, that stage of life where long-term care and those types of expenses become a real concern and consideration. So you'll want to make sure you mark your calendar for that. Again, I thank you for your time and attention today. If you need us, you know how to get in touch with us. We'd love to have a conversation with you. And have a great rest of the day and enjoy your weekend. Thanks again.
Thank you so much. Have a blessed day.
Thank you.